Hello, this is Dr. Joe Adragna, Montrose County Public Health Medical Advisor, here to give you an update on COVID-19 in Montrose County on March 30th, 2021. Let's jump right into it. Today we're going to talk about prevention. I just want to remind the community, just as I did last week, that if you're not eligible currently to receive the vaccine based on CDPHE's distribution plan, you can go ahead and sign up on MontroseCountyJIC.com standby list, and there's a very good chance we're going to be able to pull you in early to get the vaccine, generally within the same week, sometimes 2 weeks, but you'll get the vaccine earlier potentially if you don't currently meet the phasing guidelines. The reason for that is that we always have no-shows for appointment. People don't show up for their vaccine appointment for various reasons, and yet we want to make sure we get all those vaccines out during that vaccine clinic. So we'll call people in. So if you register on the standby list, be prepared to come in that day that we're holding the vaccine clinic. And if you're curious on what days we're holding the vaccine clinic, you can go to MontroseCountyJIC.com, and we'll look at those today in this presentation as well. So remember, if you're not quite eligible yet for vaccination, go ahead and sign up for our standby list. You don't have to prove health conditions or show where you work or anything like that. If you sign up, you're very likely to get the vaccine quickly. If you do think that you meet one of the phase criteria, go ahead and register and select a time slot for you to get the vaccine. Again, we're not going to verify your employment. We're not going to verify your health information. You're going to attest that you meet that criteria, and we're going to give you a vaccine. So our goal is shots in arms. We want you to get that protection. So go ahead and sign up if you meet that phase criteria. And if you don't, go ahead and sign up on the standby list, and there's a good chance you'll be able to get it early. As you already know, if you watched our video last week, we are in phase 1B4. This is the state's definitions of the phasing criteria, and this launched on March 19th. And if you are not aware, if you're 50 years or older, you're eligible, or if you have one single high-risk condition, these could be things like asthma or COPD, and a whole list of other conditions that you can find listed on MontroseCountyJIC.com or on CDPHE's COVID-19 specific website. Also, if you work in an industry that's public serving, then if you're a frontline essential worker, and there's a ton of industries that meet criteria for that. You can see some on the screen here. Just a brief showing of those would be people in the food and restaurant services, people in manufacturing, postal services, public transportation, public health, faith leaders, etc., on and on. So it's quite a broad list of industries, and there's a broad list of health conditions. And again, you don't have to verify where you work, and you don't have to show us proof that you have a medical condition. If you sign up, you're attesting that you meet some of those criteria, and you're going to get the vaccine. Our goal is get vaccines in arms. We're not going to hassle with the minutia on the details. We're going to trust that you are attesting and that you're being honest with us. If you don't meet that criteria, remember there's the standby list. You can go ahead and register for that. So one interesting thing that was recently updated, though, is that phase 2, that's the general public allocation for vaccines, will open up for mass vaccination or available vaccination through pharmacies or healthcare providers, wherever you can receive vaccine, on April 2nd, according to the state's plans. And so if that's not modified by some unforeseen circumstances, April 2nd will be the day that anybody can get the vaccine, regardless of whether they have one of those health conditions or not, or regardless of their age, as long as they are age appropriate to meet the minimum age that the FDA has provided with the emergency use authorization. If you don't remember those age minimums, it's 18 years or older for Moderna or the Janssen vaccine. Janssen's also known as the Johnson & Johnson vaccine. It can go down to 16 years of age if you're getting the Pfizer vaccine. But generally, think 18 years or older, you're good with Moderna and Janssen. If you're 16 or 17, Pfizer is an option for you. So April 2nd, that day is coming upon us very quickly. Again, go ahead and sign up on MontroseCountyJIC.com. That's MontroseCountyJIC.com, and remember that standby list. When you go to MontroseCountyJIC.com, you're going to see this clinic registration link. If you click on that red link on the website that says sign up for an appointment, you will actually pick your appointment time. And so please make sure that you do show up on time. Don't show up too early. Don't show up late. And certainly try not to miss that appointment, because it is taking a spot away from somebody else who might really need that vaccine. Remember, if you have been sitting on the sidelines, not quite ready to get the vaccine, but maybe have changed your mind, and you were in a 1A or a 1B1 or 1B2 criteria phase, you can still register even though we're in 1B4. That's okay. If you were eligible a couple of months ago and now you're ready, go ahead and register. Get the appointment appointment slot that works for you and get it done. If online is not an option for you, you can always call 970-252-4545. That's 970-252-4545 and hit option 1. That'll take you to somebody that can help you get registered for the vaccine clinic. So this week we are holding a vaccine clinic on Thursday. We're going to do about 820 vaccines. There's going to be a very, very small amount of Janssen vaccine that will be available. There is some Moderna for second doses and a little bit for first doses. And if we look to the nation, we're looking at 145 plus million doses have been administered of COVID-19 vaccination. So certainly it was reasonable for some people that had underlying health conditions or allergies to say, I kind of want to wait and see what happens. And having spoken with a lot of folks in the healthcare industry, some particularly that had allergies to various medications, they said, I feel comfortable waiting until maybe there's 1 million people that have been vaccinated, and we'll see what the data shows then. And now we say, look, almost 146 million doses administered, and of those, 95 million people have received at least one dose. That is a tremendous number. That's 28.6% of total population. When you break that down, almost 40 million of those doses, having received at least one dose, went to people 65 years or older, and that's nearly 73% of the total distributed doses. And that's a really good thing for us as a country because we've gotten it to our more vulnerable populations, those who are older in age. And then as we start to open up that vaccine eligibility, we're getting people that are younger but still have health conditions. And then, of course, April 2nd, anybody that wants the vaccine should be able to get the vaccine here in Colorado. Supply limited. Of course, there is still some supply chain challenges. Not every available provider in the state of Colorado is receiving vaccines, even when they've ordered them. And so we expect that over time we'll see growing availability of the vaccine. And so hopefully you'll be able to receive that vaccine when you want it, where you want it, within reason, right? It's going to be grocery store, pharmacies. It's going to be medical offices. In some communities, it's their hospitals, and of course, public health. And so so when we look at the state of Colorado alone, that's shown in the table below, and that shows 1,164 vaccine providers had been enrolled and approved by CDPHE as of March 29th. And in Colorado, 1.6 million Coloradans had received at least one dose, with 969,000 fully immunized, with around 2.5 million total doses given in our state. So good numbers to see there. When we look in Colorado and we say, well, what kind of vaccines have been given? You see that blue here is Pfizer, red is Moderna, and green is the Janssen vaccine. If you remember, the Janssen is a single-dose vaccine, one shot and you're done, at least pending no future boosters. The Moderna and Pfizer have a booster dose, Pfizer 3 weeks after your first dose and Moderna 4 weeks after your first dose. And what we saw was when Janssen came available in early March, there was this big pent-up demand. A lot of people were sitting on the sidelines waiting for that Janssen dosing. They only wanted one shot, which is totally reasonable. And we've seen that the supply of Janssen has not been able to keep up with orders, and so we're seeing, if you look at this graph, smaller amounts of Janssen vaccine as a percent of the total vaccines administered within that day or that period of time. Hopefully that will continue to grow as more supply becomes available. But in this day and age, it does appear that you can pretty much get whatever you want if you're willing to wait a little while. It could be Pfizer, it could be Moderna, it could be Janssen. I think they're all really fantastic. I think the Janssen is more convenient. It's a single dose option, which is nice, but all of them work very, very well. If we look to Montrose County specifically, this is data obtained by CDPHE as of March 29th. Remember, CDPHE is our state public health office. So in Montrose, they're showing nearly 21,000 doses administered. Just think about that for a moment. That's a ton of doses administered for a community that has about 42,000 in the county. Of course, Montrose has supported other county residents who have come through. Maybe they met criteria and their county couldn't take care of them, and we had extra doses, maybe on a standby list type of situation where it was either they go to waste or we give them out. We have a no waste policy here, so we give those vaccines out. And so we've done 20,959, at least they've been attributed to our vaccine administration efforts. Delta's doing a great job at 13.2, Gunnison 11.2, San Miguel 5,500, Urate another 3,200, and Hinsdale at 620. Again, predominantly the recipients of this vaccine have remained female and 60 years of age or older, and largely white, non-Hispanic, but we do see some increasing figures here in the non-white, non-Hispanic or Hispanic rather, categories, which is good to see. We know that there are populations that have been waiting to see whether this is safe and appropriate for their populations, and I'm highly encouraging all populations, all races, all ethnicities to highly consider this vaccine for your safety and the safety of your community, your family. I think that this is a game changer. This vaccine has been our only real offensive weapon. So I'm glad to see that we are making some headway here. And if you're on the sidelines, please consider getting that vaccine. If you look at vaccine distributions across the state and what Montrose County has received as a percentage compared to our relative state population, we're at 0.05%. So we've gotten just a little bit more than our relative percent of state population, but that number has fallen over the last week. And so, and we felt that. We felt that in our availability to give out vaccines through public health this week. We still are working with our community partners. Want to thank those community providers like pharmacies and clinics that are giving out vaccines because they're part of this effort. And the county public health will continue to try and support you in sharing those vaccines since the state supply is limited and they're not going directly to these individual clinics, as long as we can continue to meet our obligations for second doses. If we look at overall county status across the state, Montrose remains in the blue level. Mesa County is blue. Delta, Gunnison, Uray went to green, and San Miguel remains in blue. And so our goal is to get to the least amount of restriction possible according to the state's current public health order. Level green is the least restrictive, although they have loosened up some of the restrictions over time to these color configurations. If you're looking for more specifics on those restrictions for your particular situation or your industry, go ahead and check out CDPHE's website for more details. I'm just going to move my head over here a little bit so I stay out of your way. Let's move on and look at some other data points here, though. So if we look at 1 week cumulative incidence rates by county, Montrose is in the green, which is good. That's what we want to see. So this week reporting less than 35 cases. Now remember, this is cumulative incidence rate as a percent of population, so, or excuse me, not as a percent, but a rate of population, so per 100,000 cases, per 100,000, and we're still less than 35. That's a really great figure to see. We see the same thing in our southern county partners, San Miguel and Uray, and then we see that Mesa County, Delta, and Gunnison are right on our heels and are in blue. Happy to see that. We all want to get down on our case counts, so appreciate their continued efforts on that. 1 week average positivity for us is blue, so we're less than 5%. In the green categories, you see in Delta, Gunnison, and Uray, they've got even fewer as a percent of their positives, but Montrose is doing just fine with less than 5%. We'll look at that in more specific details in just a moment. If we look at the number of days of decreasing our stable hospital admissions, Montrose here is in blue, and we've been in blue for quite some time. Before that, the color was green that was equivalent to blue, so we're looking fine on the number of days with decrease in our stable hospital admissions. That's not an issue for us, and our partners also look good in surrounding counties. So let's look at the actual dial itself. So if we look to the left, we'll see this is last week's dial. The 1 week cumulative incidence at that time was 37.4, and now we're down to 32.7. You can see on the right dial, which was taken from March 29th. So improving in our community prevalence, lower incidence rates correlating with lower prevalence, and so we have lower amounts of circulating virus in the community is what my takeaway would be on that. Our percent positivity has gone up from 1.6 to 2.1. I'm not worried about that. I don't think that percent positivity means a whole lot because I think there's a lot of variables that impact that, like, so, for example, how accessible testing is, how much interest there is in your community to obtain testing. And so you'll see fluctuations in that. And what I find over time is that when there is increasing prevalence of the virus, there's more concern, there's more interest, there is more testing. And so we can see numbers actually drop and move positive even on a percent positivity figure, even when cases might be going up. But when we see prevalence going down, fewer tests are then being done because people aren't as concerned. They are asymptomatic, or maybe they have symptoms, but it's explained by something else, since we know that community prevalence of COVID-19 is at a low, and so they don't get a test potentially. And so then that can artificially inflate our percent positivity. I guess it's not an artificial inflation, it's just a reality of fewer tests being done, maybe being more selective in the testing that's being done, and that will result in higher percent positivity. So I don't put a whole lot of stock in that. So that to me is a minimal change. If we look down to the decline in our stable hospital days, we're at 13 last week, at 14 this week. Again, hospitalizations have been just fine. So this is looking at two data points for us. In gray, we're looking at the 14-day cases on a rolling basis. 14-day cases per 100,000 population, just to be clear. And then in the black line, you're seeing COVID-related MMH census. So this is COVID-related, that's COVID positives or persons under investigation census at Montrose Memorial Hospital. And so you can see that we are at 0 if we look at the bottom right here. We had a few days here where we had a couple of patients. We're at 0 on our census at Montrose Hospital. And we see that our community prevalence, our 14-day case count per 100,000, actually dipped down to a nadir here around March 18th. And we're a little bit higher than that point today. And I'll show you more detail on that, but we actually are increasing despite the dial. I'm going to go back to that, showing us that we went down. These are just points in time, right? So as of March 23rd, yes, we were higher than we are today at March 29th, but actually there were periods where we looked better, and I'll show you that in a more of a closer, blown up perspective. So we are seeing a little bit of an increase in cases, but I don't think that that's reflective of an impinging surge or any new concerns that we should have. I'll show you more in just a moment of why I think that. Before we jump into that, let's look at our model. So our model here is shown in dark blue. What's this modeling? This is modeling COVID hospitalizations. Now this is looking at only at COVID positive, not PUIs. And PUIs, remember, is the person's under investigation. That's the person that may be pending a COVID test. And today we don't really have many PUIs because we can get same day in-house, really highly sensitive polymerase chain reaction or PCR testing, so the gold standard. Oh, and I just noticed a misspelling here, hospitalizations. I will get that fixed next time. You don't even have to email me about it. So the model would predict that even with a 0% public health effectiveness going forward from March 1st, we would see 0 hospital census. Now, I've said this before, I'll say it again, it's dealing with a small sample size, so you're going to see little positives here and there. So we saw that in March, we got a spike up to 3 and then to 1, and so you're going to see that little ebb and flow up and down. It's not absolute that there will be never another person admitted with COVID-19, but it's just not, it's not projecting an overwhelming surge of our healthcare system. The other thing to take into consideration, there are some risks when we look at these models. So one, it doesn't take any consideration of variance, and so we'll talk about that in a moment. It doesn't know or consider whether there's waning immunity, maybe if there's still circulating prevalence of COVID-19, circulating virus within our community, and your immunity, whether it's you obtained it through natural infection and recovery or through vaccination, if that wanes, could you become hospitalized and sick? This model would suggest no, but it's built in that way, so I don't really know that. We do know that there is a risk after 90 days of natural recovery of people getting sick again, but that's very small. We've had several hundred admitted. Several hundred new infections during the last year of people who did previously recover, but as a percentage of total infections, very small. It also doesn't take into consideration the risk of having a concentrated high-risk exposure in non-immunized populations, and it also may overestimate the percent of our population that's actually immunized, because some people may have had natural infection and also got a vaccine because they didn't know they were naturally infected, or they chose to get the vaccine even though they had recovered from natural infection, which, by the way, we still recommend that you do get the vaccine even if you had already recovered from a COVID-19 infection. We think that will give you longer term protection against reinfection with COVID-19. So let's delve a little bit more into the region. And now this is not the state's definition of the region. It's just a bunch of counties that we look at on a weekly basis or more often that are relevant to our population here in Montrose. And what I've done here is I've highlighted the columns in red if that column is higher than it was last week. So what do those columns represent? This is the 14-day cases per 100,000 population. But it just displays it in a different way so that you can see how we compare to other communities and where we've been in the past. So if you look on the left, you'll see Delta has a red column. That means they have more cases than they did last week, and they're at 138 per 100,000. That's 14-day cases per 100,000 population. So 138, Montrose at 77, and so that also was higher than last week's report at 61. Montezuma is down, Mesa County is down, Gunnison County is up just a bit to 86 from 74, Uray's up to 202 from 121 last week, Summit County's up, La Plata's down, Eagle's up, San Miguel's down, Pitkin is up, San Juan is up, and Garfield's up. So that's a lot of ups. And we'll look at that in a quantifiable number here in just a moment. But that is an overall increase in the number of cases on a 14-day basis within these counties compared to the same report I gave you last week looking at those same counties. So is there an increase in prevalence of COVID-19 amongst these counties? Yes, there is. Is it a lot? No. And will it come back down? Yes. But for right now, we do see an increasing number of cases. Will that continue? Again, I don't think so, and I'll show you why in a moment. But if you're considering which communities might have a higher risk to you, of course, there's a lot of variables within that, but because these are all cases per 100,000 population, if a column is higher in one community compared to another, that means that there is higher prevalence of that virus within the community. So I would say Montrose, although up from last week, has lower levels of circulating COVID-19 than, say, Delta or Montezuma, and just slightly less than Mesa and Gunnison. Ouray, you're looking at around 3 times more circulating prevalence of COVID-19 within that community. And so you may, if you're traveling to those communities, be a little bit more conscientious of your own personal protection. If we look to the West region, which is more narrowly defined, but this is defined by CDPHE, they're looking at Delta, Gunnison, Montrose, San Miguel, Ouray, and Hinsdale. And if we look at this graph, this is showing you that we have had an increasing 3-day average daily incidence, that's shown in the black line, since about mid-March. And the graph below that, where you see the red, that means that that slope is increasing. It's above 0. So if the 3-day average incidence is climbing, you're going to see the bottom graph go red. So it's just another visual representation to show you that there is increasing cases being found. If it's green on the bottom graph, that means that you have a decreasing slope to that 3-day average incidence, which would correlate with fewer and fewer cases. And so we want that bottom graph to be green, and we want the black line to be in a negative slope. We want it to be going down. And so what this shows is we've got increasing cases within the West region. Now, we knew that because we just looked at the counties, and the only county I didn't show you specifically was Hinsdale, which is the smallest county out of that region, defined as the West region by CDPHE. But what's also good to see here is that it appears that there's an inflection point within the red graph. It looks like it has peaked and is starting to come down again on the far right side of that graph. What that means is the rate of climb in our 3-day daily average is slowing. And once that red line gets back to 0, that means that you will have hit basically a stable point, or a no growth, no decrease point. And if it continues to fall beyond that, that means you actually are going down in your number of cases, which I suspect is what it will do. And if you're wondering why this is happening, there's a few reasons. We are not at a point where we have enough recovered and enough immunized people to eradicate COVID-19 from the community, like you would say with polio, right? So the polio vaccinations that went worldwide were so successful, it was able to decrease circulating polio virus levels to a point where it was really not an issue anymore. Now we continue to vaccinate children against polio so that it doesn't come back and resurge, but since we still have low levels of community prevalence, and we still don't have the majority of our population naturally recovered or immunized, we are going to see this up and down. You're going to see these little peaks and troughs with cases. Once we get more and more people vaccinated, we'll hopefully see that this has a sustained suppression and maybe even an eradication. That's possible. We have to get to high levels of immunity to achieve that. And so if you're on the sideline, you're wondering whether you should still do a vaccine at this point, given that we have low community prevalence compared to where we've been, the answer is still yes, because it will help protect you personally, but it will also help to protect the community, because if more of us humans are immunized, we're immune against this virus, then it doesn't have a chance to take hold, to mutate, to spread, and to infect other people. And if we can shut this current version down, there's a better chance we can decrease the risk of mutations that would resurge a pandemic. Let's say in that case, if your natural infection or your vaccines did not work against some new variant of the virus. But the variants are more likely to occur with higher prevalence of the virus circulating amongst our people. So please be part of the solution and get a vaccine, as long as you don't have contraindications to it, which are very small anaphylaxis. Now let's look at variants for a moment. There are 0 found variants. Nobody has found a variant yet within the Montrose population. I think that's wonderful, but I also think it's coming. We will eventually see that within our Montrose population. There are 3 variants right now that CDPHE is tracking and making that information publicly available. That's the UK variant, the South African variant, and the California variant. And the reason why I think it's just a matter of time until we see these variants is a few reasons. One, if you look to the California variant, we've already got cases in Delta, Uray, and Mesa, so we're kind of surrounded by counties that have already seen that within their population. And we've also seen that the South African variant has spread to multiple counties. So it was just in Chaffee County last week when we reported. Now it's been found in Moffat, Pueblo, Sedgwick, Teller, and so we'll expect that to continue to spread. And the way you can prevent this from being a problem is get immunized. So the vaccines do work against these variants at this time, but we need to prevent new variants. We don't want the Montrose variant coming out. That's bad. That's bad PR, plus it could be bad for our health. So if we look at the 7-day average of COVID-19 cases in Colorado, we do see that statewide there was an increase in cases compared to this little dip or this nadir back in mid-March. So be cognizant of that increase in cases in the state. But again, very small. I mean, look where we've been. This is like looking at Mount Everest, and we're down on a little foothill here. It's still there, though. That's the point. Don't ignore that there is still some circulating virus, and if you have health conditions, that could put you at risk. Now, if we look here at the state population as its own region, we do see the same thing that we saw in the West region, increasing cases on a 3-day average daily incidence, and we see the red graph below. But you also see the state is doing that same kind of up and down, peaks and valleys, as we've had low-level community prevalence that just hasn't suppressed to a 0 level. Again, this is likely to continue, so we'll have little peaks and little troughs until we get enough people either recovered naturally or vaccinated. Now remember, if you are naturally immune because you recovered from COVID-19 infection, you should still get the vaccine. There's good evidence that it helps you to build up even higher antibody levels, and that likely will correlate with more sustained immunity. If you're interested in how our hospitals are doing across the state, we've already shown that our local hospitals are doing just fine, but statewide hospitals, hospitalization, you can see that here. So in the top left, we're looking at acute care bed use. That number is down 1% on a 7-day average compared to last week when we reported. But remember, I don't think that actually means anything. 1-2% changes here and there. That's just normal ebbs and flows. So that's basically stable. That's how I'd read that. If you look to the top right, you're looking at the percent of ICU beds in use. That's 0% change from last week on a 7-day average. Again, stable. If you look to the bottom right, we're looking at patients currently hospitalized for COVID-19. You can see both COVID positive, that's in the green, and COVID persons under investigation, that's in the yellow. Those figures are also stable, but they're a little higher than they were at that nadir, that low point mid-March, but not a whole lot higher. If we look to the nation, and specifically with this graph, you can see where our risk is coming from surrounding counties, although I would be cautious to read too much into that, and I'll tell you why. This is looking at the number of cases, not the number of cases per population, but the total number of cases in that week, March 21st to March 27th by county. And so, one trend that has just persisted this entire time is that portions of Florida, Houston area, Maricopa County, Southern California, the Northeast with, the New York and Boston area, those areas have persistently been higher in total number of cases. They're also metropolitan areas, and so they're going to have higher number of reported cases anyways. And if you look to Colorado, you see that Front Range has more cases represented by darker blue colors, and we see that in the more populated counties on the Front Range. So does that mean that we are insulated because we got all these light greens and whites around us? Well, to some extent, but when you look on travel data, our regions, particularly San Miguel, Uray, Gunnison, and coming through Montrose, does see travelers from metropolitan areas, the Houston County area, Maricopa County, the Front Range, Southern California, etc. And so we can still import cases into our community, and because this region that we live in is a tourist hub, and because we have a wonderful airport, we're still at risk of getting those variants and their cases coming right to Montrose. So just to be aware of travel risk, still can come and infect us here in Montrose, and you're traveling out to those communities, also you could pick it up there. So does that mean that you shouldn't travel? Not necessarily. You just need to use common sense and wash your hands and use hand sanitizer and protect yourself. and get a vaccine. So that is our presentation today for March 30th, 2021. Thanks a lot for being with us this entire time. If you've made it through the entire presentation, you're a trooper. If you're watching this on YouTube, please hit the thumbs up and consider subscribing and hitting the notification bell for Montrose County Public Health in Montrose County. That will help out this video getting shared with more of our population, our friends and neighbors, to make sure that they have up-to-date information. And if you are looking for the latest information, go to MontroseCountyJIC.com. That's MontroseCountyJIC.com. And there you can find out what the local numbers look like on a regular recurring basis. You can also sign up for vaccinations if you need to do that. And you can also access additional help and resources that Montrose County and Montrose County Public Health has put forward. I'd like to thank our partners, Montrose Memorial Hospital, our community providers that are giving vaccine, our pharmacies that are out there giving vaccines out to the community as well. It's been a tough and long year, and we are getting through this just fine. Light is at the end of the tunnel, friends, and we're going to be coming together closer and closer in the coming weeks. So hang in there. Get your vaccine. Thanks for being with us today. We'll talk later. Bye.